Your brain can warn you up to 24 hours before stroke. And the number one sign is so brief and so strange that 90% of people ignore it completely. We're talking about sudden blindness in one eye that lasts just a few seconds and disappears on its own. It feels like someone pulled down a black curtain over that eye or smeared the lens with gray mud. You blink a few times, maybe rub the eye, your vision comes back, and you go on with your day thinking it was blood pressure or fatigue. But what you just experienced has a very specific medical name, amaurosis fugax, which in Latin means fleeting blindness. And for neurologists, it is the equivalent of a fire alarm going off inside your head. What just happened is that a small clot or a fragment of plaque broke off in the wall of your carotid artery, traveled up and briefly plugged the artery that feeds your eye. When the clot moved, your vision returned. But that same fragment could have traveled 2 millimeters to the side, entered a brain artery, and then you would not be dealing with a 1-minute blackout in one eye, but with permanent paralysis, loss of speech, or death. In this video, I am going to explain why this sign is so dangerous, what other signs accompany this warning, and exactly what to do in the next 72 hours to prevent the big stroke from happening. To understand why your body sends you these warnings, you need to know something fundamental about your brain. It weighs roughly 1.5 kilograms, represents about 2% of your body weight, but it uses 20% of the oxygen you breathe and 25% of all the glucose circulating in your blood. It is a control center that never turns off and that needs a constant fuel line. If that fuel line is cut for even 4 to 6 minutes, brain cells in that area start dying in ways you cannot reverse. That is why doctors say stroke is a race against the clock. You are literally competing to save brain tissue before it is gone for good. What most people do not understand is that for a brain artery to suddenly block, the groundwork had been laid for years. The vessel walls were getting damaged, cholesterol and clots were building up, the opening was getting tighter. It is not an explosion out of nowhere. It is the last step of a long and silent process. And along that road, your body sends warning signals that in medicine are called transient ischemic attacks, or TIs. Transient means they come and go. They last from about 30 seconds to around 10 minutes and then disappear. That brevity is exactly why they slip through the cracks. Research published in journals like Stroke from the American Heart Association shows that a transient ischemic attack very often precedes a major ischemic stroke, typically within the next 72 hours. Those 3 days of your window where disaster can still be prevented. Sign number 1, sudden blindness in one eye. Let us go back to the number 1 sign and dig deeper into it, because it is the most important and the most ignored. That momentary blindness in one eye happens because the ophthalmic artery, the one that feeds your retina, is not some random isolated tube. It is a direct branch of the internal carotid artery, the same blood highway that feeds your brain. Imagine that carotid artery has been accumulating plaque on its walls for years, like an old pipe slowly filling up with scale on the inside. At some point, a small piece of that plaque breaks off, or a tiny clot forms on the irregular surface of the plaque. That tiny fragment travels with the bloodstream upward through the neck and reaches a fork. It can take the path toward the ophthalmic artery that feeds the eye, or it can continue straight into a brain artery. When it takes the eye path and gets stuck in that small artery, the retina, the light-sensitive tissue lining the back of your eye, loses its blood supply for an instant. The retina is an extremely delicate tissue that is hungry for oxygen, so it reacts immediately. You see total darkness or a blurry gray patch where you used to see clearly. There is no pain, no redness, no tearing. One eye simply stops working for a few seconds or a minute while the other keeps seeing perfectly well. And that detail, that it only affects one eye, is precisely the key clue that sets it apart from a simple dizzy spell or low blood pressure, where vision typically darkens in both eyes at the same time. When the clot dislodges or dissolves in flow, is restored, vision returns as if nothing had happened. And that is where the deadly trap lies. You feel relieved, you think it was fatigue, too many hours in front of screen, that you stood up too fast, or that you need new glasses. You convince yourself that if it were something serious, it would not have gone away on its own. But the reality is exactly the opposite. It went away on its own precisely because this time the clot was small enough to break free, and next time it may not be. Neurologists treat this episode as a medical emergency because hospital records show a repeated and well-documented pattern. A person ignores 2 or 3 of these visual blackouts, and the next event no longer happens in the eye, but inside the brain. And then we're no longer talking about a 30-second scare, but about permanent paralysis, loss of speech, or death. The medical Latin name is amaurosis fugax, which literally means fleeting blindness. And for any neurologist, hearing a patient describe this episode is the same as hearing a fire alarm. An urgent evaluation protocol is triggered because the window to prevent the big stroke is closing. If you ever experience a visual blackout that affects only one eye and lasts seconds or a couple of minutes, it does not matter that your vision came back completely. That is not normal and is not explained by fatigue or screens. That is your brain telling you in the clearest way it can that something very serious is about to happen. Sign number 2, sudden numbness or tingling on one side of the body. The second warning sign is sudden numbness or tingling that appears on only one side of the body. It could be the whole arm, just the hand, half the face, an entire leg, or even a full side of the body from forehead to foot. The sensation varies from person to person. Some describe it as pins and needles, others as if that body part had turned into cotton or rubber, and others simply say the area feels dead, as if it no longer belonged to them. What matters is not exactly how it feels, but 3 details that turn it into a serious red flag. First, it appears out of nowhere with no obvious trigger. You are not lying on the arm, you did not bump into anything, you are not in an awkward position. You are simply sitting, walking, or talking, and suddenly a part of your body stopped feeling normal. Second, it affects only one side. This is critical because each brain hemisphere controls and senses the opposite side of your body. When both hands go numb evenly, that more often points to cervical spine problems, nerve compression in the neck, or carpal tunnel syndrome. But when the numbness is clearly one-sided, the problem is probably not in your limbs, but in the specific brain area that maps sensation from those limbs. And third, it lasts a few minutes and then goes away on its own, which makes you think it was nothing important when in reality, it is exactly the opposite. The reason this happens is the same mechanism we explained with the eye. A small clot or plaque fragment travels to an artery that feeds the somatosensory cortex, the strip of brain that processes everything you feel in your body. Every part of your skin has its representation in that brain strip, like a map where the hand occupies one zone, the face another, the leg another. When blood flow is briefly interrupted in the map zone that corresponds to your right hand, for example, you feel your right hand going numb or tingling even though the hand itself is perfectly healthy, with its circulation intact and its nerves working. The problem is up in the brain, not down in the limb. And that is exactly what causes people to get confused and dismiss it. They look at their hand, move it, feel it return to normal, and conclude it was probably poor circulation or that they need to move around more. But once you understand that sudden, one-sided, transient numbness is the brain running out of blood in a specific zone of its sensory map, you realize the true severity of the episode. The clot that today plugged a small artery for 2 minutes and then broke free can tomorrow plug a larger artery or get permanently stuck. And then the numbness does not disappear in minutes, but becomes permanent loss of sensation or paralysis. Each of these transient episodes is a warning that your brain cannot keep repeating indefinitely. Sign number 3, sudden loss of coordination. The third sign is a sudden loss of coordination that people describe as walking drunk without having had a single drop of alcohol. You're on a flat, familiar surface, your own home, the supermarket aisle, the sidewalk you walk every day, and out of nowhere your foot lands in the wrong place. Your leg feels weak or rubbery, you stagger to one side, or grab the wall without understanding why. In some cases, what arrives is not a leg problem, but a violent spinning sensation, as if the entire room were spinning at full speed, and you have to grab a chair or the door frame to keep from falling even though you did not move fast, you did not turn your head, and you did not just get out of bed. This sign originates in a very specific part of the brain called the cerebellum. The cerebellum sits in the lower back of your skull, like a small additional brain. Its job is to constantly calculate where your body is in space and how much force each muscle should fire so that you walk straight instead of zigzagging. It is the orchestra conductor of all your coordinated movements. The cerebellum gets its blood supply from arteries that run up through the bones of your neck to the back of your head, what doctors call the vertebrobasilar system. If blood flow in those arteries drops sharply even for a few seconds, the cerebellum essentially disconnects momentarily, like when a computer loses its internet signal for an instant. And that manifests as that sudden stumble, that unexplainable misstep, or that violent spinning sensation. What makes this sign particularly dangerous is that it has many imposters that disguise it. In clinical practice, there is a documented pattern where people attribute these episodes to harmless and reasonable causes. Uncomfortable shoes, I was tired, it was probably my blood pressure, I did not sleep well last night, I slipped a little. And because the episode was so short and they were able to keep walking normally afterward, they convinced themselves it is not worth mentioning to a doctor. They only find out later, sometimes too late, that those were cerebellar transient ischemic attacks. The key difference lies in context. Benign dizziness, the kind that is not dangerous, usually has a clear trigger you can identify. You rolled over in bed, you turned your head quickly, you have a known inner ear condition like positional vertigo, you stood up too fast after bending down. In all those cases, there is an obvious mechanical cause that explains the dizziness. But when intense dizziness or loss of balance appears spontaneously, with no triggering movement, while you're standing or walking calmly, and is accompanied by any difficulty walking straight, that combination should be treated as a possible transient ischemic attack until a doctor rules out a vascular cause. Do not wait for it to happen 3 or 4 times before taking it seriously. A single episode of this kind already warrants evaluation. Sign number 4. Sudden speech breakdown. The fourth sign is in your speech, and before going into detail, I want to make a very important distinction so you do not panic unnecessarily. If you occasionally cannot remember your neighbor's name, if you temporarily forget the word for toothbrush, or if you lose your train of thought in the middle of a sentence, that is not a sign of stroke. That is what linguists call a tip-of-the-tongue phenomenon, something completely normal that happens to everyone and becomes more frequent when you're tired, stressed, or multitasking. With age, these blocks can be somewhat more common, and that does not indicate a vascular problem either. What has deeply concerned neurologists is something qualitatively different. When your speech breaks down so severely and so suddenly that even you yourself realize something is seriously wrong. It is not that you forgot a word. It is that the entire language system failed for a moment. In the brain, there are 2 main speech areas, both usually located in the left hemisphere. One is known as Broca's area, and it is responsible for forming words and sending clear instructions to the muscles of your tongue, your lips, and your jaw so that words come out articulated. When that region loses blood flow, you can understand perfectly everything people say to you. You know exactly what you want to answer, but you cannot get the words out. They come out slurred, chopped, stuck, or they simply do not come out at all. It is as if your mouth had disconnected from your mind. The other area is known as Wernicke's area, and it is responsible for understanding spoken language and organizing your own sentences so they make logical sense. When that zone loses its blood supply, something almost surreal happens. The person speaks with total fluency, without stumbling, with normal intonation, but says things that have no meaning whatsoever. Doctors call it word salad because the sounds resemble sentences, but the content is completely incoherent. And the most unsettling part is that the person often does not realize that what they are saying makes no sense, and they also cannot understand simple phrases directed at them. If either of these 2 types of speech problems appears suddenly, lasts a few minutes, and then fades, leaving you speaking normally again, that is a classic picture of a transient ischemic attack. You cannot explain it away with fatigue, stress, or lack of sleep. Speech that breaks down and self-corrects does not mean that the problem resolved itself. It means the clot broke free this time. It is exactly like your home alarm going off, stopping by itself, and you deciding it was probably nothing. The alarm went off for a reason, and the fact that it stopped does not eliminate that reason. If you experience an episode like this, even if it lasted only 2 minutes and you now feel completely normal, you need urgent medical evaluation because your brain just told you in the most direct way possible that one of its arteries is in serious trouble. Sign number 5. Vitiligo combined with new and intense headaches. The fifth sign surprises most people because it does not seem to have a direct connection to the brain or blood vessels, and yet the link is real and documented. It involved a combination of visible skin changes, specifically vitiligo, together with new and unusually strong headaches that do not fit your usual pattern. Vitiligo shows up as patches of pale or completely white skin in different parts of the body, where the pigment-producing cells called melanocytes have stopped working. This happens because the immune system, which normally protects your body by attacking viruses, bacteria, and damaged cells, makes an identification error and starts attacking your own pigment cells as if they were foreign invaders. That is what is known as an autoimmune process. Your defense turns against you. Now, what research has shown is that when the immune system goes off target like this, it rarely stops at a single target. If it is attacking the melanocytes in your skin, there is a significant probability that the same inflammatory process is also happening in other tissues in your body, including one that is particularly critical: the endothelium, that microscopic layer of cells that coats the inside of every artery in your circulatory system. The endothelium works as an ultra-smooth, non-stick surface. When it is healthy, blood components glide by without anything sticking. It is the difference between the inside of a brand new polished pipe and the inside of an old, corroded pipe full of buildup. When autoimmune inflammation attacks the endothelium, that smooth surface becomes rough, irregular, and scarred. And a rough surface inside an artery acts like a magnet for everything you do not want accumulating there. LDL cholesterol sticks, platelets cling, various inflammatory proteins deposit, and over time all of it grows into the plaques that narrow and stiffen your arteries, the process doctors call atherosclerosis. Vitiligo on its own does not doom you to having a stroke, and that is important to clarify so as not to cause unnecessary panic. Many people live their entire lives with vitiligo without a single vascular event. But if on top of vitiligo you start developing frequent, intense headaches that are different from any you have had before, that do not respond well to your usual painkillers, and that do not have a clear explanation like muscle tension, lack of sleep, or work stress, that combination deserves a full vascular workup rather than a wait-and-see approach. And here I want to add an important point about headaches in general. They're tricky because many people blame blood vessels when the real problem is somewhere else entirely. A very common cause of daily or constant headaches is wear and tear in the small joints between the second and third cervical vertebrae, basically neck arthritis. That joint degeneration can irritate nearby nerves and send pain upward into the head, and that has absolutely nothing to do with a brain artery being blocked. Headaches should not just be numbed with pills long term. They need to be decoded with a doctor, especially when they change character or combine with other warning signs like the ones we just covered. Now, I want to talk about what really destroys your blood vessels from the inside, because this is where one of the biggest myths lives. The myth says, my cholesterol is normal, so I am safe from stroke. Stroke risk is not just about what is floating in your blood. It depends greatly on the condition of that endothelial lining. Think again about the nonstick pan. While the coating is intact, nothing sticks, but the moment you scratch it, everything burns and clings. The first major enemy of the endothelium is chronically high blood sugar. Glucose is your cell's fuel, but to get into endothelial cells, it needs insulin. When your body does not produce enough insulin or your cells become resistant to it, you can have plenty of sugar in your blood while the cells lining your vessels are still starving. Those starving cells get damaged, lose their shape, and can even peel off, leaving behind rough patches where LDL cholesterol and platelets deposit easily. This process begins years before anyone officially tells you that you have diabetes. Even mild prediabetes, where your glucose is only slightly above normal, is enough to silently injure the endothelium for a long time. The second major enemy is smoking. With every cigarette, Toxic compounds hit the inner surface of your vessels and cause direct chemical damage and inflammation. At the same time, nicotine and carbon monoxide make your blood thicker and stickier, increasing how easily platelets clump and how readily clots form. When you put a damaged, inflamed vessel wall together with thick, sticky blood, you create ideal conditions for a clot to plug a brain artery. That is why smokers have roughly 2 to 4 times the risk of ischemic stroke compared to non-smokers with similar cholesterol and blood pressure numbers. And there is a detail about blood pressure that confuses a lot of people. Everyone has heard that stroke comes from high blood pressure, and it is true that chronic hypertension is one of the strongest risk factors. But an ischemic stroke often happens not at the peak of blood pressure, but at a relatively low point. Imagine a brain artery that is already narrowed by more than half because of a plaque. As long as the system pressure is high enough, some blood still squeezes through that tight segment. But if the pressure drops, flow through that narrowed point can fall to almost zero, especially if a small clot gets stuck there and the system does not have enough push to move it along. At night, while you sleep, your blood pressure naturally falls by about 15 to 20%. That nighttime dip can be enough to turn a partial blockage into a full stop. That is why some people go to bed feeling fine and wake up with stroke symptoms. Now, if you have already experienced even one of those 5 warning episodes, even if it was brief and vanished in under 10 minutes, you have approximately 72 hours where a lot can still be done to prevent a full-blown stroke. It is not about panicking, but about not wasting that window. There are 3 evaluations that are very reasonable to ask about at your next medical visit. The first is a carotid duplex ultrasound of the neck arteries, which shows both the structure of the artery and blood flow, including whether flow speeds up and becomes turbulent at a narrowed segment. The second is a blood test called glycated hemoglobin, or HbA1c, which reflects your average blood sugar over the past 3 months rather than a single-day snapshot. The values are clear. Below 5.7% is normal. Between 5.7 and 6.4 is prediabetes, and 6.5 or higher generally corresponds to diabetes. The third is a 24-hour Holter ECG monitoring, which catches heart rhythm problems that come and go and are missed by a 20-second electrocardiogram in the office. The most dangerous rhythm for stroke is atrial fibrillation, where the upper chambers of the heart quiver chaotically instead of beating in an organized way, creating swirling pools where clots form easily and can shoot up to the brain. Stroke is not a bolt of lightning from a clear sky. It is a predictable event that usually comes after years of silent vessel damage, and that almost always announces itself in advance. Now you know the number 1 sign, that momentary blindness in one eye that appears and disappears in seconds. And you know the other 4 signs that accompany it. If you recognize any of them from your own life, even if it happened months ago, write it down in plain language and bring that list to a doctor. Do not rely on your memory. Ask directly whether you should be evaluated with a carotid ultrasound, glycated hemoglobin, and Holter monitoring. Everything we covered today is for your understanding and education. Your situation is specific to you, and using this information as a starting point for a real conversation with your doctor will always be more useful than trying to manage things on your own. If this video made a complicated topic easier to follow, subscribe and hit like. And if you want to keep learning about how to take care of your health after 50 with straight talk and no fluff, turn on the bell so you do not miss the next video. Now you know the warning signs your brain sends before a stroke. You know prevention starts with keeping your body active. But what exercise is actually safe when you're over 50 and your joints hurt? After 50, you lose up to 1% of muscle every year. Your legs get weaker, your balance fades, your world shrinks. And regular gym programs only make it worse because they were built for younger bodies. That is why I created Activate After 50, a 21-day isometric plan in PDF format. Isometrics build strength by holding positions, not by moving worn joints. No impact, no equipment, no pain. Just a chair, a wall, and 15 minutes a day. Over 1,800 people over 50 are already using it. The regular price is $50, but this week you get it for just $9.99 with a full 7-day money-back guarantee. The link is in the description and the pinned comment. Secure your copy and start your day one today.